Hi, everyone. Welcome and thank you for being here today. We appreciate you taking the time to join us and hope you'll find value in the presentation and discussion. If you have questions, please feel free to use the chat or question function on your screen. I'm Kari Smith. I'm an account executive in our existing building services business unit and will be one of the presenters today, along with Clint Evans, Eric Mangles, Brian Schwartz, Lou Keller, and our panelists, Jim Grant, Nate Esser, and Zach Van Cleve. We thank them for their participation and look forward to hearing their thoughts. This is an unusual point of time we're experiencing together and presented many things we're working to make sense of. I've been a building and business owner, and like a few of the seasoned folks here today, we've navigated the impacts of the flood of '93, September 11th, the Great Recession, and a few other character building periods of time. Navigating a pandemic is a little different. The scale and novelty of this challenge enlists us all to help row the boat safely to shore, and facility stewards are the steersmen and women responsible for protecting and preserving the assets of our organization. This is our second webinar in the unique season. On April 16th, we discussed the steps we were taking to keep our employees and customers safe during the COVID-19 pandemic. We reviewed building operational strategies and looked into the future regarding HVAC design and operation. If you'd like to watch or revisit the webinar, it was recorded and is available on our Baker Group YouTube channel, or if you'd like to skip that, just let us know and we'll send you a link directly. The focus of today's presentation and discussion will be about identifying and communicating the activities and value facility management delivers to your organization so you can maintain and acquire the budget you need. For those of us in facility management, how often do we hear, I just can't get their attention, or they're focused on another project, or even they just don't get it? Well, something positive is going on. They or we are all paying attention. HR, legal, safety, accounting, operations, our production departments, our tenants, they're all paying attention, and we're wise to remember we likely do not speak the same language. So in order to elevate the awareness and understanding of what facility managers do and acquire and maintain the resources they need, we need to become great communicators and great translators. Some tips to keep in mind when translating or negotiating with other stakeholders. There will likely be differences to manage and possibly some conflict and confusion. So a good framework to start the conversation and keep things productive are facts, goals, methods, and values. Facts. Does everyone working from the same fact? Sometimes the facts or information change rapidly, daily, hourly. And different people have relevant information, but maybe they're not all on the same page. Goals. What are our desirable objectives of facility management? Are we avoiding liability? Are we working to keep people safe, save money in the short term, or protect our revenue stream? And methods. How do we go achieving the goal? And the last are values, ethics, moral considerations, assumptions about justice, fairness. Certainly that's timely in this season that we're in. And so keeping these in mind. So with that, it starts with the understanding and sharing of the role and responsibility of our facility managers. What do they do? Well, they're not strangers to complex situations. Many on this call are master problem solvers. They serve as the cornerstone of our facilities, managing the building systems. They understand how the building impacts the occupants. They respond to emergencies, adhere to building codes, regulations, prepare and manage budgets, manage short and long-term projects, and navigate an ever-increasing amount of technology. They wear all those hats generally with three primary goals: to protect and preserve the durability and aesthetics of the building, its systems, content, and data, and to ensure the health and safety of the most valuable asset, the occupants, employees, patrons, and visitors. And that's the objective of today's presentation: to provide you the knowledge and communication tools to defend the facility management budget and secure the resources you need to protect your assets. With that, I'll turn it over to my colleague, Brian.
Thank you, Kari. Hello, everyone. I'm Brian Schwartz. I'm a licensed architect and an account executive with Baker Group. I've just recently celebrated 7 years with this fine company. I'm happy to be able to present to you all today. Let's get started in discussing where to focus your budget and how that affects both productivity and safety in your facilities. Information on building health and occupant productivity we have from our experience pre-COVID-19 still applies today to our current pandemic world. Buildings exist in the working world to improve productivity. Otherwise, we could work productively every day outside. This is accomplished in the facility through comfort, safety, and efficiency. Comfort. Comfort of the occupants of the building, from thermal comfort and indoor air quality to comfort in individual and group workspaces. Safety. Safety of the occupants, from cleanliness of the building to who will be allowed in the facility. We'll be discussing that more in depth a little later with Eric Mangels and Lou Keller. Efficiency. Unfortunately, when talking about efficiencies, it is not necessarily focused on employee efficiency, like workspace that is flexible, break areas, printing capabilities, and restrooms all being near the users. No, efficiency is often tied to building energy consumption. Although a priority in an area to save budget dollars, this is the lowest priority one would want to focus on. A bit counterintuitive, but hear us out on why. This is what we refer to as the 1990. It is based upon facility operating expenses, typically applied to an office environment. 1% of those going to utilities, 9% to rent, either internal, external, or debt reduction, and then 90% to salaries and benefits of the people working in the space. We believe you can set your priorities for your budget based on this philosophy when looking at your facility in this manner. So let's break down your operating expenses. Utilities constitute about $2 to $3 per square foot. Rent, debt reduction, that's around $25 to $35 a square foot. And salaries and benefits, they constitute for $300 to $400 a square foot. Taking your operating expenses, we can conservatively calculate your savings potential. So if we do a 10% decrease in utilities at $3 a square foot, it's about 30 cents a square foot in savings. In rent or debt reduction, and just doing a 5% better in space utilization in that area at $35 a square foot, we're looking at $1.75 a square foot in savings. And a simple 1% increase in productivity, that's in your salaries and benefits area. So 1% increase in productivity at $350 a square foot, you're looking at a savings of $3.50 a square foot. So through this exercise, we can now see how to prioritize your budget. Focusing on salaries and benefits in the budget focuses on your people. As a result of an efficiency focus, productivity goes up. Let's focus on the 90% of the overall budget. This is where you'll have the biggest impact on your budget, building health, and people. There's plenty of research out there to back this idea up, and I encourage you to check out our YouTube channel or reach out to us directly, as Kari mentioned, and you can watch a two-part series that we put together specifically on this idea. In the meantime, here are some statistics to show the value this idea brings and the value on how essential facility managers and staff are to the health and safety of the building, and now the efficiency and vitality of the business. Research shows comfortable, well-ventilated, well-lit, and safe work environment raises productivity up 16%. Job satisfaction goes up 24%, while at the same time reducing absenteeism. Another study suggests keeping the office temperature in a comfortable thermal zone saves employers about $2 per worker per hour. Although this data is a few years back, the percentages still hold today. Further research from a Harvard study shows employees with greater freedom and flexibility are more productive. Work-life balance and work flexibility rank above pay. Higher work satisfaction reduces absenteeism 10 to 25%, and happy employees work 10 to 30% more hours. This data from a United Technologies 6-day, 24-person lab test showed cognitive increases in office employees that took part in the research. This study suggests high-performing green certified buildings is where this happened, but it simply breaks down to an increase in ventilation and better indoor quality that helped with the cognitive skills. Again, a critical factor that continues to better a business through the essential work that comes from the facility team and sound preventive maintenance plans. As you can see, cognitive function was up in 4 critical areas. And as a business owner, I'd want my people functioning at the highest level in these areas, specifically today in crisis response. In summary, focusing on the 90% of where business operating expenses reside is clearly where one can have the biggest impact, followed by space efficiency in the building, and then look at optimizing utility consumption. As mentioned earlier, safety being one of the keys to a functional workplace environment is paramount. Eric Mangels is going to discuss how that affects a building in their cleaning approach, an item that's getting much more attention today. Eric?
Thank you, Brian. And so what will your office staff look like when they come back to the office? Will they be fully dressed in PPE, or will they be wearing nothing else but normal clothes? Well, some of the things that'll help you is determining what type of facility you have. Medical office might be a little different than a general office, or you might be in an industrial environment. Some things we're gonna have to look at is what's your space between cubicles, your social distancing or work distancing. And if it's too tight, you might have to do some reconfiguring of your office layout to spread the desks and cubes apart. Or we might be able to put dividers up between the cubes to help keep the social distancing at a minimum. And then you're gonna have to determine what your minimum PPE for your office people are gonna be. Are they gonna be wearing face masks 24/7, or can they just wear it when they're walking about the office? But upmost is to figure out what your employees' comfort level is going to be. Some people are going to want to be isolated. They don't want to have any interaction with people, while others they're tired of this whole COVID thing and they're ready to go back to work as normal. But perception is going to be the most thing when you're looking at a cleaning budget. They want to make sure, hey, is my office clean? If my work surfaces sanitized? Is COVID sitting on my desk? So if you go to the cleaning budgets, through different cleaning companies and stuff I've interviewed, they're seeing a 20 to 30% increase in their monthly cleaning budget. Some people are using a microbial or an antivirus or sanitizing applications. There's some things you need to be aware of. Some of them have a long duration on surface that lasts 72 hours. Some might be 24 hours. So you need to know what the extended period of that cleaning or sanitizing liquid is on the surface. Right now, we're estimating if you have a COVID outbreak in your office, a one-time cleaning and resanitizing the entire building is going to cost you 40 to 60% of your monthly budget, just in that one monthly COVID resanitizing. And you're going to be out of the office for 48 to 72 hours while it's being done. The one thing I want to make sure is, with everybody coming in, everybody has their own idea of what's good and what's sanitizing. We need to make sure what they're putting on the surface. We've had one instance where they thought they were doing a great job sanitizing, but they put so much sanitizer and then people were starting to feel sick and they thought they were getting sick from the COVID, and it was actually the sanitizing stuff they were using in the building. So they had to cut back on the amount of sanitizing they were doing in the building. The other way we can look at is if you try to go as much touchless as possible. If you don't have auto flush toilets in your facilities, or labs and sinks in your kitchens, another way is to put a door pull on all doors. Anything that you can do to keep people from touching a surface. That way it has a tendency not to spread as much if somebody does get sick. Now Lou's going to show you other ways that you can help going touchless in a facility.
Thanks, Eric. My name is Lou Kelleher. I've been at Baker Group 3 years, but I've been in the security industry for 34 years. Another thing we can use is automatic door operators. You can provide touchless entry and exit utilizing either a wave sensor instead of a button, and you could also use card access or facial recognition so that doors would open either way and you wouldn't have to touch the buttons and contaminate. Camera technology can also contact trace. If there was a person that was positive for COVID, you could forensically go back in time and see who they talked to over the previous days and address that accordingly. Finally, thermal cameras can read temperatures of people entering the area or the building. And the next slide shows a kind of a typical setup. you'd have a person there at a desk with a monitor, and it would read, normal people would be fine, but somebody with over 100.4 degree temperature would set off alerts, and then you'd address that accordingly. Thermal cameras do not require an NVR. Emails can be set from the cameras directly to whomever, and you could also connect it to your existing camera system to recording. Hot beverages, hoods, and masks do not decrease the accuracy. Now Clint will discuss maintenance strategies.
Good morning, everybody. My name's Clint Evans. I'm here to support Jim as the other Hawkeye grad in the room to prove that we know things about mechanical systems also. So whether you're the proud owner of a new building like we are, or a new facility, or a very proud owner of a more aged facility, the building and mechanical systems carry a cost of ownership. So we're going to take a look at some of those costs and help understand what we can do to positively impact the outcome we're looking for. So as we review this particular one, obviously the cost of capital, the asset itself, parts and materials, contracted services, and in-house, downtime, major repairs, energy waste, and admin. But if you focus on the right side, and in this particular example, you can see the annual cost of ownership and the difference if we could extend the life of that equipment. And so what we're going to focus on is how do we do that? And in our example, our discussion, that's through proper preventive maintenance. So as we look at this particular representation, a few things just to unpack some of this information is, number one, across the bottom, those are just numbers for reference. Those aren't months or anything other than just a number we can refer to during the discussion. The blue line, they indicate the investment in preventive maintenance dollars. So as you can see, if we start on the left and work our way down, all of these represent just different strategies. The orange line would be what we would expect to have as subsequent mechanical breakdown costs, repair costs, even replacement. But as you see, as we move our way down in our approaches, as we focus less on the maintenance, not only are we going to increase our repair costs, but it's certainly going to have an impact on the energy that we use also. So then if what that does, all of those feed into the yellow line, which is the overall cost that you would expect. So as you see, as we invest less and the energy and the repair cost increase, some of those reasons for that dramatic increase on the right might be overtime charges, parts house access fees, and even in worst case scenario, you may end up replacing the entire piece of mission critical equipment. Since there's a whole unit in stock locally, the parts might take longer to get. I call this the Steve principle. My good friend Steve was going on vacation with his family, going far out east, and knew he had some van problems, didn't address them before he left, and came home a week later with a new van he had purchased in Indiana on the way home. Got towed to a dealership, and so that does an accurate job of describing, the types of corners we get painted into when we neglect our equipment. So I'm going to ask you just to put yourself on this graph. Where do you feel your current maintenance approach would land on the graph, and do you have the tools to move yourself to the left? And what we have found to be the best approach is represented there with number 3. And so what that represents is, as we focus on this is not the total cost of your building, but just the mechanical equipment that Baker Group or another vendor you have might be taking care of for you, or even your in-house staff. And so what we have found over 20 plus years of tracking this with our contract customers is what we have represented in number 3 is $1 of preventive maintenance generally will lead to around 70 cents in repairs. And that would be the impact on the budget. As that moves farther down the right, you'll see that as deferred maintenance or a lower investment in your preventive maintenance will just add to that multiplier or to that ratio. And if you really wanted a flatline budget, one thing that you could consider, again, whether it's us or your current vendor, is what we would call a comprehensive program, where what that really means is we perform the preventive maintenance, but we as the service provider are also responsible for the repairs of the equipment. So you can be sure you're getting the best maintenance, knowing that we're or your other vendor is going to be absorbing the risk of the downtime on that equipment. So in these tougher times that we're in and unstable budgets or fear of the future, if you really wanted to flatten that line, that is certainly something you could consider. And now when you also factor in the cost of downtime to your staff, if you think back to Brian's presentation of the 1990, and what would that represent if a large air handler that serves your entire facility or the boiler or chiller, something really mission critical, breaks down, what would happen there? And even today, knowing everyone's pretty aware of air quality, if that air handling system was down for repairs, what might your staff be thinking about or talking about other than focusing on their work? So as we look at this particular graph, this just really helps to understand where is our building in its life cycle and its systems. And so these have all been normalized or adjusted for ASHRAE useful life. So you can see some rooftops might have even though the building's the same age, some of the things may be well under or well above their projected useful life. Maybe RTU 4 and 5 in this example have already been replaced. And so this gives a representation. And if we monetize that graph into those items that were above the line, in our particular case, you know, I think a lot of people might be surprised to know, or some of the C-suite members of your team you're talking to, there might be well over $1 million of assets, mechanical assets in your facility. So if we apply the age and the projected cost, we'll see that we can create a pretty accurate picture of what is our financial risk laying out there of our assets that have been past their useful life or might be in poor condition. So, you know, one way to consider this might be like your home. You know, would you replace the carpet this year if you really knew that next year your roof that's 5 years past life is going to be $5,000–6,000? You know, it helps you make those long-term allocations for your facility. And frankly, maybe you would choose to do both and invest in that capital and take out a loan, or in our case, some of that capital budget that your company has set aside, knowing that you have this risk out there and the associated additional costs that are going to happen by neglecting that $440,000 in the red portion. And something new that just came out is as part of the CARES Act. You may not have heard about it yet. It actually first came out from the World Health Organization, and it was the Who Cares Act. So I think people probably didn't pay as much attention as they were supposed to. But some of the details that may provide you some options is that qualified improvement, or these QIPs, are deductible in 2020. You can see the list of systems that may be covered there. And of course, there are stipulations that apply, different ownership models, different tax situations. One of the other potential benefits is if you've done some improvements even dating back to 2018 and you were on, for example, a 7-year depreciation schedule, they might allow you to expedite or take the remaining 5 years in 2020. So now might just be that time to invest in those, in your assets that are well past their useful life. So with that, we're going to want to pass it over to our panelists. We have Brian will introduce them, and we'll get a better idea of how their budgets have been affected, what strategies they might be using, and they can share that information with us.
Thank you, Clint. Well, what we've discussed is based upon our experiences in assisting clients in maintaining infrastructure of their facilities. Those being mechanical systems, electrical, building automation, security through cameras and access control, parking systems, truly the lifeblood of what runs a building. Those systems still need to be addressed through maintenance and facility budgets. We all know the world has changed through recent events. The workplace has as well, but it's different for different industries and workforces. To get a good understanding of that, let's turn this over to our panelists who've graciously given their time to discuss their new worlds. I'd like to introduce Jim Grant, who's with Wellmark, a leading health insurance company, Nate Esser with Iowa Clinic, a healthcare services provider, Zach Van Cleve with REG, or Renewable Energy Group, a provider of clean, renewable fuels. Jim, let's kick this off with you and then go down the line to Nate and Zach. Let me throw a softball here to get everyone started. Jim, how do you plan to completely stop the virus, and how will the economy react to your or the efforts of your esteemed University of Iowa? I'm just
Well,
messing with you. I'm messing with
as you know, the University of Iowa is leading in the cure for the being the #1 university in the state as a medical, facility. We're leading the cure for the whole world. So the Hawkeyes are out front, I'm sure.
It's got to be. It's got to be. So no, for real. Your real question and to kick us off is, what are you doing to prepare for people returning? And what has been the impact on your facility's budget?
That's I kind of joke with people in my office that we are planning, we're putting plans together, we're then throwing those away, making a new plan, and then we're throwing those away and we're making a new plan. So as the virus has changed, we left our building on March 16th and we're down. Took us a little bit a while, about 35 people in our building on a daily basis. So that's 600,000 square feet of office, 1 million square feet when you include parking, and we've got 35 people in it. We were anticipating coming back. All right, is this going to be quick? Are we coming back in April? Then, now we're coming back, mid-May, and then our CEO just said, hey, don't plan on coming back at all until sometime after the 4th of July. And it still is up in the air, but we are making a ton of plans for when people do come back. You get on Outlook and it says, hey, I can book this meeting room and it holds 25 people. We might remove half the chairs, and Outlook needs to be changed so that it shows, I can only get, 12 people in this conference room now. So we're looking at all things like that. So we're looking at keeping people safe. We're looking at individual responsibility too. So what is the responsibility of the people who do come back? They need to clean up after themselves. Do they need to wear masks? Our pantries are just the way the building is built. You can't social distance in them. Is it now going to be one-way traffic? How are we going to communicate that? What signage do we need? There is a small area in our building where we do need to reconfigure our furniture so that we can be more than 6 feet apart when we're sitting at our cubes. What's our cafeteria going to look like? Where are we going to put hand sanitizer for everybody? Fitness rooms are going to be closed. Are they going to be open? Most likely they're going to be closed when people start to come back, and we'll open those later. So we really almost got a few people around. We just walked the building and said, here's an area. How are we going to handle this from a facility standpoint? So that's kind of what we've been doing from a planning standpoint. And then from a budget standpoint, we were looking at every single vendor and every single service, and we broke it up into what can be cut, what's non-negotiable, and then even what are some new projects that we want to do while people are gone that we can get to, even increasing our cleaning to what we kind of call hospital grade cleaning, painting, things that we want to do, things that we couldn't do while there's 2,000 people in our building. We can definitely do them when there's only 35. So we've been looking at all of that, and from a budget standpoint, we saved a bunch of money on the fact that you go into our building and it's like you're there on a Sunday. The HVAC is set back a little bit, the lights are all off, but we spent a little money making all of our restroom doors are automatically open now with a wave system, and so we haven't really saved any money, but we haven't spent any additional money either because we're just reallocating that to other projects. So that's kind of what we've been working on. I don't know if I answered your question or if there's other specific things that you
No,
want to jump on.
No, that's good stuff, Jim. Let's kick it over to Nate and hear his side.
Yeah, so obviously we have a slightly different perspective here being in the medical world. To piggyback on Jim on budget, I guess in some ways we're fortunate because since we're a medical facility, we have a higher level of cleaning that's done every night. We also have nurses, and part of their duty is to wipe down exam rooms between patients. We have front desk staff, and part of their job is wiping down counters and waiting room chairs. So from that perspective of workflow and cost, we've remained fairly neutral. We do have a few opportunities similar to Wellmark where we have shut down facilities for periods of time or every other day, and we've had some savings in HVAC and lighting, but obviously that's on our scope of those buildings is pretty minimal. Where we're seeing the biggest impact budget-wise is everything related to COVID. At our entrances, we are screening, so we have 2 employees at every entrance all day long. They ask the questions of every person coming in. We take the temperature of every person coming in. We have additional security on staff to help with patients that don't want to comply. Starting tomorrow, actually, we're going to start requiring masks on every person that enters the building, where it's just been recommended before. So my problem becomes, it's not necessarily a building budget issue, it's a COVID cost center issue. And I think there's probably a lot of people in this boat who have thrown all this money into this separate bucket, hoping that whether it's the PPE program or the CARES Act or some other source of funding will come along that we will qualify for, and we can easily identify that the cost that we've put into it that is tied to COVID, we can quantify and turn it over and hopefully get a little bit of relief off that. But at the end of the day, if that doesn't happen, then that will roll over and just be a cost that's absorbed by our clinic. So we're a little bit in the wait and see phase, but we are, looking at the same things you presented on. Do we change out a camera that can sense temperatures, but we still have to have screeners there asking the questions. So we're changing our strategy about every 3 to 4 days right now. But yeah, it is definitely an impact on the budget. If we focus more on our support service buildings, we are probably up, as we look at returning to work, about 20% in our cleaning costs, just because we don't have the same protocols in those type of facilities as we would in our clinical facilities. We have been able to bring back staff in the clinical setting as patient volume increases. And that's a little easier to control. On our support service side, our non-clinical setting, that's where we're really having a lot of discussions on who needs to be in the building, who doesn't, and how can we provide a safe environment that people are going to feel comfortable coming back to, but more importantly, as an employer, is defensible that we have done a realistic amount of planning and proactive cleaning process, etc., that we will not have anyone trying to come back and say that they got COVID because of us not doing our job. Similarly, we're, cubes 6 foot by 7 foot, you got a wall in between, so you're 6 feet apart. Are we all comfortable with that? We're doing the same thing with break rooms. We've eliminated a lot of the chairs so that we're forcing 6 feet of spacing in all those. Same with conference rooms. We're going to be providing wipes, Clorox wipes, so that when people come in, if they want to wipe down their workstation every day or whatever the case, they can do that. But we are also going to be doing screening at those locations as well. So through our card access system, I've locked all the doors down except for one that they have to come in, and we will be taking temperatures and doing the questionnaire for all those employees as well. And we are even in the middle of discussions on whether for these non-clinical staff, we may be providing them all a mask and saying, when you're at your workstation, we're comfortable that you're 6 feet apart, but whenever you're getting up and walking in the common area, going to the bathroom, getting coffee, you need to have a mask on. If somebody comes over to your cube and wants to have a quick chat about something, you need to put your mask on. That may be a little easier for us to do because that's kind of the norm of our course of business and everyone's wearing the masks. But it's definitely going to be an adjustment for non-clinical staff that are going to be asked to do that when they're not at their workstation. So I think we're all in the same boat of trying to figure out what's the right way to do it to make everyone feel safe. And there's no easy answer, especially depending on what industry you're in. But I don't think COVID is going away anytime soon. So we got to figure out a plan to live with it and continue to keep our business operational.
Perfect. Thanks, Nate. Appreciate both you and Jim's different perspectives on that. We got one more with Zach. Do you want to chime in here, Zach?
Yeah, sure. First, thanks for the invite here, and it's been really nice to listen to what you guys have and all of our panelists so far. So I won't travel. I think we've covered a lot of the things so far, so I won't travel too far down some of those items that we've covered. As far as budget, again, we're probably in the same realm. So OpEx, we're looking 10 to 15% increase, and that just comes from basically supplying or building up our stockpile of supplies directly related to COVID. So whether that's masks or thermometers or sanitizer, disinfecting wipes, gloves, all of that. We've done some in-house fabricating of plexiglass dividers for cubicle spines. Like many facility managers, obviously our building was not set up to accommodate COVID-19 totally. So we've got some older style cubicles that, we find ourselves, 4.5, 5 feet where we're having to make some modifications. And so that's had a little bit of a cost. And some of those might roll into bigger CapEx costs here down the line. Floor signage, wall signage, so that's everywhere. Just general reminders, letting people know, making sure it's always top of mind. The custodial cleaning budget, that's probably went up by a third, and that's basically just enhancing, adding more hours all around the cleaning, sanitizing, what have you. I think the biggest thing for us is obviously the work from home. So, like most people, we started the work from home their third week of March, and so far it's really worked out, and so it's allowed our office to it's allowed our people to stay safe, and it's allowed, I guess, the facility managers and our emergency response team to really prepare and explore some of these ideas that are going to be part of this new normal. So that's been huge, and I'll commend our SLT for having such a flexible policy, and to all of our managers that make that work, because it's tough. I think the biggest impact that we're going to see obviously revolves around the CapEx, and a lot of what we talked about is very true, in the regard that I have 2 or 3 25-ton RTUs that I've planned on replacing this year, and now I'm trying to decide, well, do I take that $225,000 and am I going to have to direct that toward COVID-19 specific CapEx stuff. So whether that's the automatic door operators, whether that's the UV or the high efficiency air filtration in my HVAC units. One of the things that we had I guess we're fortunate enough to have, I mean, we had a third commercial building sitting vacant, 15,000 square feet that, now we're starting a CapEx to essentially activate that building to help with the social distancing. So again, maybe not many people have that, or companies have that opportunity, but where you see some people or some companies maybe backing down, and that work from home is gonna maybe cause less of a need for buildings. We kind of went the other way, and we had the space, so why not get it active and allow our other two buildings some breathing room. So yeah, it'll be interesting to see how it all plays out. I will say though that to reiterate that the COVID-19 has definitely changed our world, and as a facility manager and as folks that focus on the budget, there's going to be probably some tough decisions to be made as far as what gets through and what doesn't. So hopefully we can keep the ship headed in the right direction. But yeah, I guess that's our perspective up here in Ames. I've heard a lot of Hawkeye talk, so I'll throw in a one for the Cyclones. I don't know how many people that makes mad, but
Thanks very much, and thanks for mentioning the Cyclones. That's awesome. So I do have a couple questions here that, Jim, when you were talking, you'd mentioned some energy savings focused. Have you been able to save very much energy with the cost of few people in the building?
So, I've been disappointed in our utility bills, but I've got to kind of be realistic on that as well. You kind of, okay, no one's in the building, it's going to take a huge dive. We're still running our data center. Lighting is about 12% of my bill. I know that thanks to Baker Group helping me break down all my utility bills over the years. So just the fact that we're turning lights off, I should see some savings. But you look at the bill that I got in April was for half of March, half of April, and we were still occupying a good portion of that time. So it's gone down. I saved about 20 grand off the last bill that we just got. But I put in $80,000 worth of automatic door openers, so it does offset. But we have seen some savings there. We're not running our fans at the same speed. We're not doing all of those things. So utility savings, yes, I've seen it. I've definitely seen it in water. We don't really have any gas in our building, so that has been really kind of moot. But we anticipate to still save that. I mean, we're running into the summer months where Mid-American Energy jacks up their rates, and it'll be interesting to see what my next couple of bills come out to be. One of the things that's in our non-negotiable, I've seen owners in my past life where they've wanted to just shut the HVAC off 100%, which is, our theory is don't do anything that's going to create a bigger problem, when you go to start things back up. So we are basically running our building. We call it as if it's a Sunday afternoon, and it's been Sunday afternoon for a few months now, and we'll continue that program.
So Jim, as people start coming back to the building, are you going to do it in phases? And as you do that, have you looked at increasing the amount of ventilation you're using, more outside air to flush the building, or?
Our system was superiorly designed by Baker Group and some other folks, and it is, we have a slightly different system than an RTU system that that, you know, I can just bring in more outdoor air. So we have all the outdoor air that we need coming in, so that we're not really increasing that. We already have kind of what we talk about surgical grade filtration systems. Hospital grade is kind of, you know, so our systems, I guess we're lucky enough that building our building 10 years ago, we're still a very modern building that has very modern HVAC systems. So that's one of the things I didn't have to worry about or try to figure out, because, you know, we're getting everything that we need from that standpoint as well. So we're probably, when people do come back, yes, we are phasing them back, but the air systems are right where they need to be.
Good. I got one more question for you. As people start coming back, and I know it's a moving target because it changes every week or every other day, what steps are you taking to make people feel more comfortable in their spaces? What kind of communication or what are they going to see when they come back?
So we want them to come back, and our theory is the building should not be a water cooler talking point at all. So it's got to be 100% clean. We went home, as I mentioned, in March, and we engaged our janitorial firms, and we did some super cleaning, detail cleaning, deep cleaning there. But then people haven't come back, you know, so if anybody comes back and they see the building dusty again, they're going to be like, oh, nothing was ever really done. So we have to make sure cleaning is that way 100%. There's a lot of communication. Our communication department, we're working with them on the signage, the reminders of social distancing. Hey, only 2 people in an elevator. How's that going to work? Are people going to follow those rules? So communication is key. Making sure they don't see anything wrong with the building. They can see the things that we've done with the automatic openers, and I won't bore you with details, but things along those lines. We'll actually want to brag about that stuff. Hey, we did that for you. We did that for the safety of us, and our entire comeback program is based on 2 principles. One, is it going to be safe for our staff? And 2, can we still take care of our customers? Those are the 2. All of our plans are based on those 2 principles, and we just want to make sure that, you know, if we can't take care of our customers and we have to come back a little faster, we will, and we'll take the appropriate precautions. But if we are taking care of our customers, let's not push it either and come back just for the sake of coming back. So that's kind of our balance that we're trying to figure out, like everybody else in the world.
Well, thanks, Jim. I know it's always going to be a changing every week the new CDC guidelines come out, and it's going to be a moving target. It's going to be hard to hit. I do have a couple of questions for Nate. Nate, of all your clinical and non-clinical staff, are they back at work yet in all your buildings, or how are you phasing that in?
We are not back yet. You know, at our peak in late March, early April, we were probably down about 55% in terms of daily visits. So obviously that's directly related to how many people you need at the front desk to check in patients, how many nurses you need. You know, when you aren't seeing as many patients and you aren't billing, you don't need as many billers or biller coders or IT staff or accountants. So some of that for us is a little proportional. We've probably brought back, probably half of the people that we had furloughed. So we're probably at about 70% now, I would say, in the clinical side. In the non-clinical side, we have brought back probably more than that. We're probably at about 85%. It's just most of them are working remotely. And then that's obviously the next phase of decision making is, at what point do you bring everybody back? And, you know, to Jim's point, trying to talk about bathrooms and elevators and break rooms and all that, there's a lot of opinions on it. So it's not a quick process to figure out.
So my next question for you is kind of a two-edged sword. Both Jim and Zach, they're pretty much office spaces. So they have to concentrate on their employees, on how their employees feel coming back to work. While you have your office staff that need to feel comfortable, either clinical or just regular staff, but you also have customers coming in. And what's the two different situations of how you're going to get people that are coming into the clinic feel safe, not too regulated that they get mad, and then how do you treat your staff?
Yeah, no, exactly. Like most things these days, there are polar opposite opinions. So we have people that come in and they want to fight about, we can't tell them they have to wear a mask, to people that are wanting to call and yell at us because we aren't enforcing everyone to wear masks. So we get both sides of the spectrums. We're leaning a lot on our chief medical officer and our physician leadership team to kind of steer towards what should we be doing for our patients to make sure they're safe, especially our large facilities that are more specialist driven. And we have a lot of really sick people coming in, and they are very nervous and apprehensive, and we're trying to do everything we can to show them through pushing messages out to their portal or email blasts from our marketing team, but kind of list out, here's all the things we're doing to keep you safe. You can check in ahead of time so you don't have to touch anything. We're not having more than 3-4 people in a waiting room. Even if you got to pull them back and they wait in an exam room, let's get them out of that common area. The screening at the door and all the question helps with everybody. But like I said, it's still a battle with the people that don't think this is such a serious problem. So it's a balance for us, but the more that we can test and assure and communicate with them, the better. In terms of our staff, we're using similar documents and trying to gear them towards our employees. So we know you're nervous to come back into the office and into a setting with more than 10 people. Here's all the things that we have done since you left, and here's all the things that we're going to continue to be doing, including any data that we can share. So, running some benchmark testing on how clean is their environment before and how clean is it when they come back, trying to be completely transparent with that. There's a fine line. We're having a discussion this morning on our leadership team about sending out a survey to employees, and it's you got to be careful with that, because if they give you an answer you aren't expecting, what are you going to do with it? So we're having a lot of internal debate on how much do we really want to get their feedback, because we can't necessarily adapt to what they say. It may be a better approach to just reach out to them to explain and lay out everything we're doing, what we're going to continue to do, and why, as a medical group, we believe that is keeping them as safe as possible. So it's meetings, 2-3 meetings every day, and some are geared towards patients and screeners and check-in, and some are geared towards our employees and our staff and how we bring them back. But for us, we are quickly approaching where it's just not going to be mathematically possible to keep everyone 6 feet apart when we get back up to about 90% of our patient load. So starting to get heads wrapped around that, what will that look like? It makes it a little easier for us if we require everyone wears a mask, then that relaxes that 6-foot rule a little bit. But just the optics and the ingrained anxiety that people have from the last couple months is going to make that a challenge as quickly as we want to get back to normal clinical visits and operations financially, balancing it with what our patients are comfortable with in the setting that we are seeing them in. So it is constantly evolving, and it's going to come to a head at some point here, which is good, but it's also going to make some people uneasy.
Thanks, Nate. It sounds like you have a big hill to work upon. Try to make everybody happy.
Yeah.
I mean, without getting too restrictive that people start getting mad that they have to do extra steps, and
Right.
it would be tough.
Yep.
So I got a question for Zach. Okay, now that you've been working from home, how many people are going to be returning to your business? And now that they're out and they've been at home working from home, are people starting to give a little pushback saying, no, I'll just continue working from home and I don't want to come back to the office? Because that's
Yeah,
what I
so
hear a lot of people are saying is, well, no, I'm fine. I'll work from home from now on. And I want to know how you're handling that.
yeah, so up here in Ames, we're not back in our office yet either. We've taken a phased approach with some pretty conservative gating criteria that we haven't met yet. But that being said, I think we'll start to ramp up a little bit here in the next couple of weeks. And when I say ramp up, maybe get to 30, 35 people in an office or offices of 300. But there is conversations going on between facility managers, SLT, HR on that exact question. And at the end of the day, we're not meeting face to face. In our first phase or maybe our first two phases. So really, if you're going to come to the office and sit in your cube and not really meet with anyone, you're going to be doing all your meetings on Zoom or a virtual platform. I mean, what's the real benefit of being here? So we've kind of taken the stance on, for now, if you're not mission critical, if you don't have to be here, we don't want you here. And we definitely anticipate that when we get down into phase 2 and phase 3, where we think we can get ramp up back to normal, we'll have people that kind of speak out, and so we're anticipating that. But at the same time, it's changed our world. So the people that bring that up, I mean, that might be a real possibility now that when we get back to where we think is normal, we have quite a few staff working from home, and if it's working, then I think that's a real viable option. And I think that's the important part here too. Is so we've been going 3 months here, and we've had 300 people supporting our 10 refineries around the country, and we haven't seen any hiccups. So it just goes to show you that at least with our business, we didn't know if it could be done, but we it's kind of tried now, and kind of thank the Lord that it is working. So who knows if there'll be big pushback when that time comes or not. In my opinion, I think we'll definitely see a change, and I think we'll see a lot more work from home, and it might be a win-win situation for us.
Thanks, Zach. Okay, so I'm going to try to end up with one 2-part question for all of them, and since Zach's on the line already, I'll just start with him. Okay. Have you got much pushback from the upper level management of how much your budget is being used right now for COVID and COVID related stuff? And second, now that you've started spending this money, when you're budgeting for next year or 5 years out, what does your budget look like for the future when now you've had to deal with the COVID right now?
Yeah, so on the operating expenses, you've got no pushback at all. I mean, we're definitely all about safety, vision zero, number one priority. And so it's been me communicating up, saying, okay, just a heads up, we're going to be over this amount, this is where the funds are going. And it's been nothing but, go get them. We want you to be doing that. I think a lot of the CapEx stuff, so getting into anything above 15, 20,000 COVID related is I'd say it's on the table. But I think those were where the discussions are happening on how far do we want to go, what is going to be, what are we going to get the most bang for our buck in which projects. And so I wouldn't say I've got any pushback there, but definitely probably more of a slowdown as far as trying to prioritize what's needed. And then the second part of your question was for looking at next year. All of that CapEx stuff that we're considering this year, if it doesn't get, if we don't get through it this year, it'll be on the budget next year. And then all the OpEx stuff will be added to. So we'll probably see a budget increase, but we may have areas where, we're not going to be able to, we won't spend as much money, whether that's travel or printing or some of those other items. So I think that helps, and hopefully it'll balance out. So yeah, that's my perspective.
Thanks very much. Well, I just been told that it's getting close to the end of the thing, so I need to wrap it up. So I'm going to turn it back over to Kari, and she can send us off.
All right. Well, we want to thank our panelists and everyone for participating today and your time. I wanted to share a thought, something I heard this morning. In the spirit of today's discussion, as well as Clint's friend Steve and his vacation, there was a discussion about planning for your summer vacation, and the phrase was pack your patience. And so we know that what I'm hearing is that we're going to continue to evolve in an ever-changing environment. So, and certainly our panelists have demonstrated their flexibility and collaboration and ability to navigate this changing environment. Key takeaways: facility operations is an essential function. It's complex. We need our master problem solvers at the table, protecting and preserving the assets and occupants. We need to secure and retain the assets that we need, collaborating with our other stakeholders. And it does create that opportunity to review your maintenance strategies and share the value of what you do with those other stakeholders in your organization. So we know that each of your facilities are unique, each organization is unique, and we're here to help. If you'd like to talk about your existing program or your future budgets, or we can help about review new HVAC strategies, please feel free to reach out to us. Again, we thank you for your time. Have a great day.